Hi, I'm Dr. Kendall Peters in Orlando, Florida. I am a plastic surgeon. We're here talking with Kay about her eyes today. And thank you for coming in. Kay is a new patient. And maybe we can start off, Kay, by telling us what it is that you're hoping to improve or what bothers you about your eyes.
My eyes feel heavy.
Okay.
I feel like I am always squinting, and when I look in the mirror, I just look tired.
So with your eyes closed, I can see that you really do have quite a lot of folding and hooding of the extra skin. You can open for me again. That being said, I can see that your muscles of your eyelid that control the opening and closing are very good, and you don't have any problems with that because where your lid position is relative to your pupil and the rest of your eye. So you would be a good candidate for upper blepharoplasty to remove some of that extra skin and tissue and to help you get that extra eyeshadow space that you're looking for, and also to make you look a little bit more refreshed and not so tired, okay? And when I look at your lower lids and assess them, I'm gonna just turn your head over right towards the camera over here. Basically what you have is you don't have a lot of herniation of the fat pads of the eye, and that's often causes bags. You don't have that, so that's a good thing. You do have some crepiness, as we call it, of the skin, and so, and then turn back towards me. And so we can improve that by doing a skin pinch lower blepharoplasty and a little bit of resurfacing of the skin of the lower eyelids. I'll just explain a little bit to you about the surgery. This is something that we'll typically do in our surgery center. It'll take about 30 minutes per eye. The incisions for the upper lid will be hidden in the natural lid crease right in the center of your eye. The lower lid incision is hidden right in the lash line on the outside. And so all of those incisions, the scars heal beautifully, and they're very well disguised by your natural anatomy here. The recovery after the surgery is, I'll tell you, most people are a bit swollen for the first week. We do bring you back at a week, take some of the stitches out from the upper lids. The lower lid stitches are typically dissolvable. And then you can be swollen for a little bit longer, sometimes up to a month, but most of the time people's bruising and the majority of the swelling is taken care of in the first week. But most people can get back to work within about a week to 10 days after the surgery. But you will have some minor swelling after that that's going to take a little bit longer to go away. For that reason, I ask people to not do any excessive or extremely physical exercise for the first 4 weeks after the surgery. At that time, usually you're good to go. Thank you for coming to talk to us today.
Thank you.
All right, have a good one.